Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everyone. This is Dr. Omar Nagy. First of all, I would like to thank Dr. Mazen for giving me this opportunity to participate in this virtual conference. Actually, I have participated in the last conference, and this encouraged me to participate in more conferences. So thank you, Dr. Mazen. You're really doing a great job in spreading the knowledge among all our colleagues. So النهارده إن شاء الله هيكون موضوعنا عن retrieval of migrated implants into the maxillary sinus. وأعتقد إن بما يعني مع تطور الإمبلانت while everyone now is just making implant, where everyone now is doing implants, you will face complication. And if you try to convince yourself that you will not face complication, so you are now trying to convince yourself that you will not work. يعني أي حد بيحاول إن هو يشتغل سواء implant أو سواء surgery or even the simple restoration, you will face complication. اللي ما بيعملش complication هو الشخص اللي ما بيشتغلش. فتوداي احنا هنتكلم عن one of the most nerve-wracking experience that you might encounter as an implantologist, as a surgeon, وهي how to retrieve a migrated implant أو ازاي ان احنا نطلع implant حصل له migration into the maxillary sinus. So محاضرتنا النهارده هتكون بداية يعني الليكتشر أو الليكتشر overview. هنتكلم سريعا عن ايه الاناتوميكال consideration of the maxillary sinus, the causes of implant displacement into the maxillary sinus, complication reported with displaced implant. وهنتكلم أكيد طبعا عن different treatment modalities general approaches for removal. وهنتكلم طبعا عن core of our lecture today. هنتكلم عن tips and tricks for implant retrieval and what to do after retrieval. واخيرا هنجاوب على السؤال the fate of unretrieved implant. يعني لو سيبنا بس الامبلانت سيبناه كده موجود في الساينس, what will be the fate of the unretrieved implant? So let's start with anatomical consideration of the maxillary sinus. يعني I have been taught that if you are not into anatomy, you're not even a doctor. يعني لو انت بدأت اي عملية without ان انت knowing what is your anatomical limitations here, and or to prepare yourself of what you are likely to encounter right now, you are not into surgery. Surgery عبارة عن anatomy. Whatever your skills, whatever your gadgets that you have, you will not be able to do any surgery unless you know thoroughly or understand the anatomy very carefully. So الماكسيلاري ساينس ده عبارة عن جزء من مجموعة من البارانيزال sinuses. We have the ethmoidal sinuses, which are located near the nose. We have one pair of maxillary sinus, and we also have the maxillary sinus, which is the largest one, which is اللي احنا هنتكلم عليه وهو أكتر مكان بيحصل فيه migration للإم. The maxillary sinus itself opens with the nose through something called the ostium. يعني في connection between the nose و between the maxillary sinus, this is called the ostium. وده اللي بيخلي ان الماكسيلاري sinus هو جزء من ال respiratory system. It's not a part of the oral cavity. It's part of the respiratory systems. علشان كده هو بيبقى له قوانين تانية غير قوانين الأورال cavity. So when you are trying just to deal with the maxillary sinus, you have just to fathom that you are dealing now with a respiratory system. You are not dealing now with a GIT system, which start with the oral cavity. طبعا الماكسيلاري sinus بيكون lined بممbrane. This membrane is called the Schneiderian membrane. You can easily distinguish the Schneiderian membrane by this thin radio-opaque line. يعني كل الأشعاعات طبعا إحنا كلنا as a dental or as a dentist and as a dental students, you can easily distinguish. تقدر تعرف بسهولة جدا الماكسيلاري sinus by just ان انت تتريسنج thin radio opaque line. طبعا thin radio opaque line ده it doesn't represent the membrane itself. It represents the highly osteogenic area of bone. يعني هو membrane of itself is a soft tissue mass. It should appear in the radiograph like radiolucent, حاجة لونها اسود، لكن اللي بيبان راديو اوبيك هو بيبقى نقطة التقائه مع العظم. لكن احنا بنقدر نحدد بعد الماكسيلاري ساينس عن الالفيولار كريست لو احنا بنحط امبلانت طبعا عن طريق this thin radio opaque line. وفور those of you who are into sinus lifting، اكيد طبعا ناس كتير جدا اللي اشتغلوا maxillary sinus lifting قبل كده عارفين الموضوع ده، ان if you want to participate how to make sinus lift you have just to participate on an egg where you are trying just to separate the eggshell from the membrane underneath. ازاي ان انت تفصل الممبرين عن الاكشل itself. It takes a lot of meticulous work just to master this, but it eventually pays off if you participate a lot. لازم برضو تبقى عارف ان الماكسيلاري ساينس او الشنايديريان ممبرين ده it can be stretched to a limit. يعني احنا ما نقدرش ان احنا نستريتش الشنايديريان ممبرين ده without being teared الى ما لا نهايه. هو له تقريبا حوالي 124% من حجمه ممكن ان انا اعمل له استريتش اللي هو الشنايديريان ممبرين، ودي an arbitrary measure. ده it's not a fixed measure، لكن كانت اتعملت عليه ابحاث قبل كده، كانوا يجيبوا الشنايديريان ممبرين وبيتراي ان هم يستريتش as much as they can علشان يشوفوا الشنايديريان ممبرين ده ممكن ان هو يكون stretched قد ايه. النيرف سبلاي of the maxillary sinus اهم حاجه بالنسبه لنا هي حاجه اسمها الانفرا اوربيتال نيرف. الانفرا اوربيتال نيرف we can find it in the roof of the maxillary sinus، يعني بنلاقيه هنا كده في الروف قرب الانفرا اوربيتال او قرب الانفرا اوربيتال ريم. اوكي so if you are trying لو انت بتشتغل في الماكسيلاري ساينس سواء بتحاول to retrieve something of the maxillary sinus or even you are trying just to make maxillary sinus lift، لازم تبقى عارف ان انت حدودك لغايه هنا. ما تحاولش ان انت تعدي اللاين اللي هو اللي بعد اللاين ده بيبقى فوق، علشان you will jeopardize الانفرا اوربيتال nerve if you are trying ان انت to use any instrument which will eventually leads to numbness or nerve injury لو انت قربت من الانفرا اوربيتال nerve. البلاد سبلاي والماكسيلاري ساينس بيبقى اكتر حاجه بتنكاونتر during السيرجريز بتكون هي البوستيريور سوبيريور الفيلار ارتري. البوستيريور سوبيريور الفيلار ارتري ده بيسبلاي الماكسيلاري ساينس، وبيكون في ساعات كتير جدا موجود في الشنايديريان ممبرين. يعني يمكن دي this is a photo you can see here. طبعا ده meticulous dissection علشان يقدر ان هو يفصل ال posterior superior alveolar artery عن الممبرين فيبان في فوتو like this. انت ممكن تواجهه وانت بتعمل الساينس ليفت، او حتى وانت بتحاول انك تفتح ويندو علشان تدخل الماكسيلاري ساينس. Sometimes it's a small artery, sometimes it's a large artery. It differs from a person to another، لكن هو في الأول وفي الآخر it's a source of bleeding. You have يعني just to expect it, but eventually it will stop. يعني with pressure eventually it will stop. يعني as you can see here in this video we are now making a Caldwell lock approach. Just we are trying to make in this operation we are trying to make a sinus lift. بس احنا لقينا ان في بليدنج، فالبليدنج ده لازم نبقى عارفين انه من البوستيريور سوبيريور الفيلار ارتري. وas you see here it's pulsating لان هو artery، فايتس pulsating like this as you see. اوكي you just know ان انت ممكن تواجهه، ولو واجهته هو بالبريشر ممكن ان انت توقفه. يعني just بالبريشر باك هو eventually بيقف. don't get terrified. Okay. It has another implications to know ان في حاجه اسمها posterior superior alveolar artery، لان انت لو عملت له injury it will affect some potentials of the Schneiderian membrane itself او الغشاء المحيط بالماكسيلاري ساينس. بس يعني هو ده not our topic for today. Of course you can see posterior superior alveolar artery في فيو اللي هو في الكورونال فيو في السي بي سي تي. A gentle reminder كده الكورونال فيو is just the view where you face your patient. يعني اما بتشوف البيشنت من كورونال فيو وجها الى وجه، ده كده الفيو اللي هو اللي انت تقدر تشوف فيه ال posterior superior alveolar artery و you can see it في واحد من الثلاثه دول. يعني ممكن ان انت تشوفه like this or like this or like this. This is all coronal views. Okay, you can see the posterior superior alveolar artery. So before ان احنا نبدا اي operation we can anticipate if we will likely ان احنا هنشوف this artery or not. اخر حاجه يمكن عن الماكسيلاري ساينس وهي وجود الاندروود سبتة او السبتة اللي بتبقى موجوده، بمعناه ان الماكسيلاري ساينس is not like a one room. في بعض الاحيان كتير جدا بيبقى عندنا الماكسيلاري ساينس بيبقى كذا روم. يعني المعلومه دي بتبقى مهمه لان في بعض الاحيان انت بتحاول انك تعمل ريتريفال اوف ان امبلانت، تحاول انك تطلع امبلانت من الساينس وتلاقي نفسك انك انت وقفت، ان انت خبطت في لايك وول، في حاجه زي حيطه. ففي الحاله دي انت بتحاول انك انت to bypass this or to remove it with burr just to reach the unretrieved implant او displaced implant اللي بيبقى موجود. Of course it has another implications لو احنا بنعمل maxillary sinus lifting especially from the lateral approach. So السؤال الحقيقي هو ليه ممكن يحصل عندنا displacement into the maxillary sinus؟ يعني ليه الامبلانت ممكن ان هو يدسبليس معانا في الماكسيلاري ساينس؟ I guess first and foremost هو غياب البرايمري ستابيليتي. يعني احنا لو ما فيش برايمري ستابيليتي من الاول حطيت الامبلانت و you don't check if you have primary stability or not، انت ممكن تفقد الامبلانت بتاعك. احنا دايما يعني عندنا كلمه كده في الامبلانت ان البرايمري ستابيليتي هو سيد الموقف، هو اللي هيحدد بعد كده حاجات كتير جدا. Of course there are a plethora of another contributing factors for implant survival, but primary stability is one of the important and crucial factor just يعني to make sure that your implant will survive. You can check the primary stability either by ratchet during an insertion or by a device called a stem. Okay, especially زي ما احنا قلنا في cases, a compromised cases like this. يعني case like this you don't have enough bone، لسه رافع الممبرين، بتحاول ان انت to place an implant. You have always to make sure ان انت عندك primary stability because you don't want to end up with an implant which is displaced into the maxillary sinus or an implant which is failed implant. طبعا another contributing and one of the big factor is periimplantitis. Periimplantitis ده مرض العصر. يعني because now we have lots of patients with implant. We have before patients with the periodontitis and gingivitis. Now we have periimplantitis. And the problem with implant in the implant itself doesn't heal naturally if it got يعني if it has periimplantitis. The implant itself needs a special treatment لو هو في periimplantitis، لأن periimplantitis بيعمل bone loss، والbone loss will eventually lead in انت lose your implant. The third cause is inappropriate sinus lift. يعني والكيس دي يمكن يعني انا بشوفها كتير جدا، ان يجي لي patient he tells me I did a sinus lift، وتبص في الاكس راي تلاقي ان الامبلانس موجوده، there are radio opacities which represent ان هو كان في bone graft, some kind of bone graft or something like this، وبعد كده بعد كام شهر تلاقي ان الامبلانت displaced. Actually بيبقى يعني حاجه من ال contributing factors او الفاكتورز اللي بتخلي في inappropriate sinus lift ان انت ما بتبقاش متاكد اذا كنت انت بعد ما عملت الساينس ليفت ورفعت الماكسيلاري ساينس ان you have an intact Schneiderian membrane. يعني انت لازم after every sinus lift لازم تتأكد تماما ان Schneiderian membrane is intact. How do you make sure? By مثلا ان انت ask your patient ان هو to take breath. يعني this as you see في الفيديو ده, this video represent a lateral approach for the sinus lift, and this is represent a crystal approach. In both ways, أنا دايما ask my patient, I always told my patient, please take breath, please take breath, and then to check the membrane as it goes forward and backward, or if it's come up and down with the crystal approach. So you have to check and to make sure that you have to check the integrity of the Schneiderian membrane, and that the Schneiderian membrane is not perforated, because perforated Schneiderian membrane will lead to a compromised implant, which will lead eventually to a displaced implant into maxillary sinus. Well, يعني دي يمكن واحدة من الحاجات اللي احنا بنشوفها كتير جدا، خصوصا among oral surgeons like me. دايما بنشوف ان ناس كتير جدا بيبقى همهم الاول والاخير هو الامبلانت placement, and they don't consider the prosthesis. Okay, actually the prosthesis affects a lot implant stability and survival rate. If you have unfavorable force over your implants, you will eventually end up with a bone loss, which will eventually lead to a displaced implant into the sinus. يعني لازم ان احنا approach الامبلانت from a multidisciplinary approach, from the periodontology approach, from the surgery approach, from the prosthodontics approach. يعني لازم ان to understand the implant from different approaches علشان تقدر to evaluate و to end up with a successful implant. So what are the complications? ايه الcomplications اللي احنا نتوقعها لو انا عندي implants displaced into the maxillary sinus؟ ودي حاجه من الحاجات المهمه واللي دايما بتتسال، يعني البيشنت ازاي عرف ان هو عنده implants displaced؟ يعني في ناس يقول لك مثلا في patient عنده implant displaced, he hasn't complained of anything. Is that really happen? هو بيحصل. يعني احنا لو اتكلمنا عن الكومبليكيشن of course عندنا الاورو انترال communication، ودي بتبقى يعني complication which is salient complication، وبتبقى ظاهره وواضحه للبيشنت وكل حاجه ان البيشنت عنده regurgitation وعنده اورو انترال communication. But not all patient with a displaced implant into the maxillary sinus have an oro-antral communication. مش شرط، في بعض الأحيان بيبقى فيه oro-antral communication and sometimes not. تمام؟ بس الحاجات اللي بتبقى موجودة كتير something like sinusitis, which is one of the most common complications. nasal drip, nasal obstruction, headache, and even migration to other places. يعني one of complication للإمبلانت إن هو ممكن migrate to other areas of other than الماكسيلاري sinus زي ما هنتكلم بعد كده. يعني I have proudly my students and I have conducted a systematic review before about this, and we have found many complications reported. And guess what? One of the most highest complication is asymptomatic patients. يعني في أحيان كتير جدا بيبقى عندنا asymptomatic patients وبيكون البيشنت ده بيكون asymptomatic. البيشنت doesn't complain of anything, okay, but he has a displaced implant inside the maxillary sinus. So the real question now is, what are the different treatment modalities to approach a migrated implants؟ يعني احنا we started this lecture by mentioning ايه هي anatomical structure, what are the complication, why this might happen. دلوقتي احنا لازم نشوف how to treat or how to mitigate this problem. So we have to know ان احنا عندنا general approach. يعني لو احنا عايزين retrieve the implant او ان احنا نجيب الامبلانت تاني من الماكسيلاري sinus to make retrieval, we have تقريبا حوالي 3 approaches. The first one is through the intrasocket approach, which is really limited يعني انت بتحاول انك انت تطلع الامبلانت through a tiny hole while it's يعني maxillary sinus بيكون كبير جدا في احيان كتير. Sometimes it works but sometimes it doesn't work. Okay, we have to consider this in the intra-socket approach is not always a feasible treatment modality, or not, it's not always a good approach just to retrieve an implant. بعدين عندنا culpable look approach which is the most commonly used one. ده أكتر حاجة بنستخدمها علشان نحاول إن إحنا نريتريف الإمبلانت من الماكسيلاري sinus. And finally we have the nasal approach. And when we say the nasal approach, when we mention it, it's always accompanied by an endoscope. يعني sometimes احنا بنيوز الاندوسكوب او المنظار من خلال النوز to retrieve الامبلانت. Sometimes we use it even in the culpable look approach. Okay, بس دايما النasal approach is accompanied by the endoscope. That means you don't expect that you will retrieve an implant by your naked eyes through a nose. You will never do this. You will, unless the implant is displaced to the nose, which we will discuss about. We will talk about this later. بس هو في أغلب الأحيان لو إحنا هنستخدم nasal approach, we have إن إحنا to use the endoscope. So let's go now to the core of our lecture. We will now talk about tips and the tricks. I used these tips and the tricks, and these tips and tricks have been mentioned by different literatures. So I hope you will be able to retrieve your implant by one of these tips. So I will give you today 8 tips just to retrieve your implant, and what tip that doesn't work. So the first thing, and foremost is you have to determine where the implant is, because implant moves. لو انت خلاص you have located and you know that you have a displaced implant into the maxillary sinus, the implant itself, it moves through the maxillary sinus. Sometimes it stays in a particular place, and sometimes it moves. It floats freely inside the maxillary sinus وبيتحرك على طول جوه الماكسيلاري sinus. فبليز try ان انت to take an immediate pre-operative radiograph before you commencing your surgical procedure to retrieve it. Take an immediate pre-operative radiograph. Do not depend on your patient's old X-rays. Just take an immediate, because an immediate radiograph will allow you to determine what your approach. احنا اتكلمنا من شويه عن ال 3 approaches اللي هم either intrasocket او culpable look او through the nose. But inside a culpable look approach اللي هو lateral sinus wall approach, we have different approach. Implant like this. اللي هي الصورة اللي تحت دي, implant like this, you will open a window in position A. Implant like this, you can retrieve it with an intrasocket approach. Implant in this position, you will retrieve it with a P approach. Okay, and implant in the tuberosity or in this area, you will retrieve it with a D approach. So we have different places to open our window. ما فيش fixed place where you will open your window and you will find the implant. لا, it depends a lot about the implant. You anticipate where is the implant is, and sometimes you make a combination of all of these approaches. في بعض الأحيان إحنا بنفتح فتحتين. ساعات بنضطر مثلا إحنا نفتح in A position and in D position, ولأن أنت مثلا ممكن تفتح على ال A position would find in the implant moves to the D position. So at this time you have to do the 2 opening. Tiny tip, which good visibility is mandatory. Don't expect that you will open a window and you will find it. No, I wish that will happen, but this usually doesn't happen. Usually you open a window and you will find you will end up with an empty dark room, which is a maxillary sinus. So you are really blind when you are dealing with a maxillary sinus. You have to light it up. لازم ان انت تحاول تنوره. لازم ان انت تحاول تشوف. So I never ever go to retrieve a maxillary sinus without an endoscope. And I don't go with a fancy instrument. I just buy an endoscope. انت ممكن تجيب endoscope من online shopping. Not a fancy one. أنا مش عايزك إن أنت تشتري مثلا endoscope which is fancy. أنت you can get an endoscope for even maybe $50 or $40 just to get an endoscope, and it's easy attainable through any online purchase platform. You can get it. Okay, لأن الاندوسكوب will allow you إن أنت to see الإمبلانت. يعني أنت بتتake pre-operative X-ray, you determine where your approach or where your window, but of course nothing is compared to إن أنت تبقى شايف و direct disability. So in the scope you can as you can see in this video, okay, I'm trying just ان انا اشوف where the implant is. I try ان انا move in the scope in multiple direction and finally I found my implants. If you want to see again, انا دخلت هنا من ال cold will look approach. In the scope itself it lights the sinus, the dark room of the sinus, and you can see على طول implant which will allow you for a better retrieval. So our tip, make an immediate pre-operative radiograph. تاني tip, try ان انت choose in the scope for a good visibility. And of course, if you are into and you have the dexterity, we have the gadgets to retrieve an implant from the nose. There are more advanced endoscopes, which is a functional endoscope, which has got يعني حاجات معينة للretrieval, but usually you will not have this in your clinic, maybe in fancy clinic or in the operation room where you have where you can just work on your patient under the general anesthesia, but most probably you will not have this kind of endoscope. You can just buy endoscope زي ما قلنا عن طريق أي online purchase platform. And of course CBCT. Of course CBCT. It's not all about CBCT, but you will have CBCT. يعني for an image like this, لو انت جات لك panorama like this, أول حاجة انت هتفكر فيها إن الإمبلانت is in the eye. It has migrated in the eye, which is very rare. يعني implant can be migrated to the eye after being migrated to the sinus lift, but it's very rare to migrate to the eye. It's very rare فعلا إن هو migrate to the eye. لكن لو انت شفت, this is the same case like this. تمام. This implant actually is in the nose أو في حتة اسمها الاسمويدال sinus. It will be very easily retrieved by a functional endoscope. يعني انت ممكن ان انت تجيبه بسهولة جدا بحاجة عن طريق اسمها functional endoscope. So فكرة انك انت تحكم على or to judge this only from panorama is not feasible. يعني لو خصوصا في areas like this, في positions like this, يعني you have ان انت to go for CBCT. And okay, so you can see here this is a truly implant in the eye, but this is not the same case like this. الكيس دي هي الكيس دي, لكن دي is not this. Okay, so you might end up with an implant in the eye, which is unfortunate. Actually, it might happen. Maybe only 1 or 2 cases report about this. It might happen, but you have to make sure. That's why you don't have just to depend on panorama. Another thing that you can use is the surgical aspirator or the high suction. So whenever I've been called to retrieve an implant from the maxillary sinus, the first thing I ask about is, do you have a high suction? Do you have a surgical aspirator? Because surgical aspirator creates a negative pressure inside the maxillary sinus, which will allow you to withdraw the implant itself. And this has been documented in many literature. Maybe as I have discussed previously, my students and I have conducted a research about this and a systematic review about this. And the systematic review ends up that most literatures have mentioned they have used a surgical aspirator during retrieval of the maxillary sinus. you don't want to depend only on this. Of course, there are many things that you can do and many tips and tricks as we are going through tips and the tricks, okay? But this is one of the most robust thing that you can do, or the thing that you can really help you to retrieve the and the use of saline. Use of saline, actually, because saline acts as a vehicle. Okay, so if you have a floating implant and you cannot retrieve it, you can just make a saline irrigation along with the suction, as you can see here. And as I have mentioned before, you have just used a high suction, and try to fit it snugly. Try to fit it snugly علشان you create, just to create a negative pressure, just to withdraw the implant. So you can use a saline, okay, and you can really end up with a suctioned implant through this. This is also one of the tips, to use a Valsalva maneuver. Actually, Valsalva maneuver have been used for so many years to detect many things, okay, like microvascular malformations, and it has been used by anesthesiologists to check many things, okay. We can also use the Valsalva maneuver by asking your patient to pinch his nose, okay? Or you can pinch your patient's nose and ask him to breathe through his nose. So all the air will come through the window that you have created to retrieve the implant, and the implant will go through this window, okay? As I have said before, this is not only, but it will help you. Curved curate. This is one of my favorite instruments to retrieve the maxillary sinus, because the curved curate is curved, okay? And it will allow you just to have a tactile sensation of the serration in your implants, okay? Yani you can use this curved curate just to retrieve, or just like you are doing the curate for the bone itself. It will help you, and yani, it has also been mentioned in many literatures. And of course, the curved vascular forceps, which has been used just to grasp the implant, okay? Some authors prefer something like tweezer, okay, but I prefer the curved vascular forceps, because curved vascular forceps will allow you to go through the hole that you have created to retrieve the implant, and it's actually of great use. I have tried many more times. This also have been described in literature, just to ask your patient to lean in a lateral recumbent position, so the implant will come with gravity, okay? Don't ask your patient to stand up. Don't ask your patient to turn your patient's up downs. No, you don't want to do this to your patient. Just ask your patient to lean in his lateral recumbent position, so the implant will come with the gravity. It will help you, actually. So these are the 8 tips. I will give you something, because I have been always asked about this question. Why we don't use magnet? Actually, titanium is not a magnetable. You can simply know this answer by Google it. I wish it was magnetable, and I كنت أتمنى إن الimplants فعلا it was magnetable, so we can use a magnet just to retrieve the implant easily. It will be easily retrieved. But unfortunately, titanium is weakly magnetable. You will have no use of magnet in retrieval of the dental implant. So these are my tips and tricks. Now we will go what to do after retrieval. Yani, congratulations, now you are now retrieve an implant from the maxillary sinus. What to do afterward? Will you just close the flap that you have already created? I guess the first thing that you have to consider is closing the window. closing the window is mandatory because the ultimate goal of this is just to reconstruct the patient. You don't want to only solve the problem, but you want also to reconstruct the patient or to consider this patient for a further reconstruction. So please try to close the window. حاول انك تقفل الويندو اللي انت فتحتها علشان تدخل وحاولت ان انت to retrieve the implant from the maxillary sinus. You can use a titanium mesh. Of course, you can use a membrane, either it's collagen membrane or it's non-resorbable membrane, but try to use something, one of things just to close the window. علشان انت you don't want في الآخر ان انت تبقى الجزء ده يبقى compromised, so you will not be able to do another lateral sinus lifting approach. So try and enter to close the window, and even you can make a great use of the buccal bed of fat. The buccal bed of fat is versatile, and it has many uses in oral and maxillofacial surgery. You can use a buccal bed of fat to close your window or to close the oro-antral communication, and it's easily attainable. يعني buccal bed of fat, it's easily attainable to get the buccal bed of fat, especially when you are considering to close a large defect. This is also one of the trick. If you have a baso and you created a window and you want to restore it, you can just simply suture it. Simply suture it by making 4 holes and 4 holes on the window and 4 holes on the lateral wall, and just to try to tie your knot over there so you can fix the window again, and you can try to reconstruct. And of course, if you are up for doing something like this, you need a resorbable suture. The second thing that you have to consider after retrieval is, please be sure that you have done a watertight suture, because you don't want to end up with another complication or another oro-antral communication. And this is actually one of the most important things that I usually advise everyone who is working in sinus. Just make sure that you are making a watertight suture like horizontal methods, and make sure that you are just fixing your flap again without any tension, so you don't end up with another oro-antral communication. And of course, like any sinus surgery, you should prescribe analgesics, antibiotic, and of course, nasal decongestants. Another thing is, because as we have said before, the ultimate goal is to reconstruct this area, because not only we are just trying to find a solution, but we are to thrive to reconstruct this area afterward with another implant and make another sinus lift. So if you have a compromised sinus lift, because you will tear the Schneiderian membrane. يعني خلينا واقعيين، انت علشان تدخل وتريتريف الامبلانت you will tear the Schneiderian membrane. Okay, of course you can close the window afterwards by any means that we have discussed before, but you have a compromised lateral wall now. So please try to master another way or another approach to make a sinus lift afterwards. لأن الجزء ده هيبقى compromised. You have a torn Schneiderian membrane from the lateral approach. So please try to consider another approaches, like the palatal approach. I have worked on this technique during my PhD studies, and it's a great technique. Okay, you can do a palatal sinus lifting through the palatal. Of course, it has its indication. This approach has its indications and contraindications, but one of indications is a compromised lateral wall. So you can go through the palatal approach like this. You open a flap, you open a palatal flap. You're just trying to create the window. You lift your membrane, and then as you see here, this is the implant. Okay, this is the implant inside the sinus, and the Schneiderian membrane is above. This patient had a compromised lateral wall because another doctor has perforated the membrane during an attempt to do a sinus lift from a lateral approach. or a buccal approach. So now we can go through a palatal approach just to try to lift the membrane. And of course, you have always to check the integrity of membrane, as we have said before, by asking your patient to take breath. So let's move to the final part of our lecture here, and the commonly used question: what is the fate of unretrieved implant? What if I left implant in maxillary sinus? What it will happen? Will it heal? Will patient feel something, or will patient feel nothing? This actually, plus all of these questions arise usually with a complication, with a nerve-wracking complication like this. So the fate of unretrieved implant is like the fate of apical third. You remember, as you remember from your undergraduate studies, we have I myself teach my students what is the fate of a remaining apical third. So we have now the fate of unretrieved implant from the maxillary sinus. So if I left implant, one of the things that might happen is the implant itself might migrate to another places. And usually the first place that the implant might migrate to is towards the nose or to the ethmoidal sinus, okay? Because as we have mentioned before, the maxillary sinus is connected with the nose through something called the ostium. So you might end up with an implant in the nose. It might يطلع لوحده، وممكن ان هو يفضل موجود في النوز، وفي الحالة دي هيبقى very easily, you can retrieve it very easily by nasal endoscope. It will be very easy to retrieve. But this is the first place. ده أول مكان أنت تشك إن الإمبلانت if implant goes through أو disappeared from the maxillary sinus، أول مكان تشك فيه هو النوز، because the maxillary sinus is connected with the nose through the ostium. المكان اللي بعد كده هو الآي. وزي ما قلنا قبل كده، يعني هو في يعني not large case reports about this, an implant that migrated into the eye after being migrated into the maxillary sinus. But usually أما بيحصل الموضوع ده بيكون في severe infection والبيشنت بيبقى بقاله كتير جدا بيشتكي. يعني in case like this you can see there is a defect here which represent infection, and that's why the implant displaced into the eye or here. يعني بيبقى الكلام ده نتيجة infection. لكن usually the first place that you will look for implant into هيكون دايما هو النوز. يعني after the maxillary sinus تاني مكان على طول you anticipate ان الامبلانت هيهاجر له هو النوز. and this comes down لحاجات كتير جدا. اولها هو الفرق في البريشر او السيلري movements. يعني many literatures have attributed this to many things like السيلري movements of the Schneiderian membrane itself. في ناس attribute this to the negative pressure between the nose and the maxillary sinus, but أكتر حاجة documented إن ده the first place that you might find your implant into. There are reports of an implant that disappeared. Maybe only one report اللي قالت إن الإمبلانت ممكن disappeared مرة واحدة من الساينس وما يعرفوش راح فين. بس برضو الليتريتشر قال إن هو ممكن إن هو يكون راح through الأوستيوم وإكسبلست out of ostium والبيشنت كان نايم، لأن هو ده كان التفسير الوحيد لليه implant displaced. one report لimplant displaced through the sinus to the nose to the stomach, which was يعني very rare, but we have a case report like this, but no other places. يعني ما فيش places مثلا implant migrate من الساينس للمخ مثلا او انه migrate من الساينس لللنج، لا ما فيش. هو يا اما بيروح للنوز اللي هو غالبا النوز احنا بنريفير للإثمويدال ساينس لان هو بيبقى located near النوز وبتبقى very easily to be retrieved. السكند بليس بيبقى الاي وده في حالات السيفير انفكشن، يعني بيبقى بيشنت بيشتكي وبيبقى فيه سيفير انفكشن فبيحصل بون ريزوربشن فممكن يمايجريت للاي. لكن ما فيش ريبورتس عن implants migrated to other places عن الحاجات. فده اول فيت ان هو الامبلانت may be continuously migrate to other places. الحاجه الثانيه ان هو الامبلانت might remain asymptomatic. ممكن الامبلانتس ان هو يفضل وما يعمليش مشاكل. yes it has been reported. تمام، يعني خصوصا في cases where the implant is very high near الانفراorbital place او near الاوربت او البيشنتس has gone through different attempts to retrieve الامبلانت through الماكسيلاري ساينس من الماكسيلاري ساينس. في الحالات دي يعني في كذا ريبورت عن الموضوع ده ان الامبلانت ممكن ان احنا نسيبه لو هو asymptomatic. Of course you have to inform the patient. I know this might be heavy on you وعلى البيشنت، تمام، لكن it happens. تمام، ويعني ريبورت وكان الفولو اب حوالي 5 years. Of course further studies about this is needed but there are case reports about this. الفيت الثالث ان هو يعمل symptoms like sinusitis, like blockage of the nose, like nasal drip, like oral intercommunication. في الحالة دي it's mandatory, it's not an optional to leave your implant. You have to remove it. Either you refer to an oral maxillofacial surgeon or to try another attempt to retrieve the implant. So that's all. Thank you again for listening to me. Thank you, Dr. Mazen, for giving me this opportunity to present my lecture. I hope that I have shed light today about this topic about this complication. ممكن زي ما اتكلمت في الأول يعني احنا بنعتبر دايما ال complication it happens with everyone. واللي ما عملش complication ده ما اشتغلش. You have to be prepared. We hope for the best, but we have to be prepared for the worst. Okay, so we have to know the different tips and tricks for to retrieve an implant from the maxillary sinus. Of course, you can ask me any question either in the YouTube channel, in the comment below, or I'm very approachable. You can contact me either in Facebook or LinkedIn, Instagram, WhatsApp, or whatever you want. I will be really glad to answer all of your questions. Thank you everyone for your listening and hope to see you again in another lecture. Thank you.